So we're here doing a treatment for someone whose shoulder is out of its socket. And they don't call it subluxation on my end because you technically need to be a doctor to diagnose it, but we call it the finger width drift. So it went from 1 finger width to 2 finger widths just in the week since we started. So what I have here is an activity that with the ESTIM unit right there, and the pads placed on supraspinatus connected to the biceps, and at the same time the teres minor, I'm trying not to get faces here, connected to the triceps. We have it on a synchronous pattern so that the shoulder will be into the socket. So with this particular pattern, it's increased hand flexion on the right. So for my client, what he's doing is whenever the machine turns on, because the biceps is helping the hand fist, they're placing a clothespin in the right hand, and then at the same time, left and right are active, doing the same action. So we could choose a fist, we could choose like a prehension like this, we can choose one like this. Some people think they're cheating by using the other hand to help, and I say, no, not cheating, because we're using this. We've got to do the sensory motor combo for the brain to recalibrate with both sides. So then when the machine is off, their job is to use this flannel to scoot the forearm across the table and hand the other clothespin over to someone next to them, trying to keep the forearm weight bearing on the table just to come from the scapula to move. So the shoulder blade in the back is trying to do this movement. So that's kind of this activity. Highlights: when you first turn this on with intensity, do one lead at a time. So one channel at a time, and say, do you feel it? When it's on constant setting versus synchronous, which turns on and off. So then, okay, I feel it, I've got a contraction, I can handle that. Then you move to the synchronous setting again and practice this, if you can, a few times a day. Okay, so it's again keeping the shoulder in the socket, recalibrating the nervous system for the right pattern, and having the hands function together, the same activity. Breathe, breathe, breathe. Anything else that I didn't say?
I don't think so.
Okay. All right. So this is in particular for shoulder approximation to hand function with an ESTIM unit machine for home. We set at 30 minutes total. On time, off time is based on your therapist. The tolerance to it, at any time you can turn it off. You can turn intensity up or down. All right. Thank you very much.